Cervical cancer is a type of female cancer that develops specifically in the bottom area of your uterus. So cervical screening is a free health test offered on the NHS. It looks for human papillomavirus, HPV. If HPV is detected, it also looks for abnormal cells in the cervix that can be associated with developing cervical cancer. It is not itself a cervical cancer test, but it can pick up those who may be more at risk of developing it in the future.
So people often ask, do I still need a cervical smear screen if I've had the HPV vaccination? Yes, you still do. We would still recommend it. The HPV, you can still catch HPV even though if you've had the vaccination, so it is still important. And no vaccine is 100% protective.
So I was diagnosed with cervical cancer at age 30, which is 13 years ago now. I am really fortunate that I am here, that I survived that. The symptoms I had were really minor. I had a cervical smear a few months before, but I was late in having that because I'd had a baby. So when I did come to have the symptoms checked, I was referred straight to the Liverpool Women's Hospital, where they immediately said they thought there was a tumour on my cervix. I underwent a radical hysterectomy, which obviously has physical and emotional impact of no more children. I was fortunate I already had a child, however, but no more. The impact since then has been huge in terms of my emotional mental health, health anxiety, the impact on family and friends. Family and friends have obviously been to more screening appointments now than they would have before because it's raised their awareness, and for a few minutes of discomfort, the impact it can have is absolutely huge, because a diagnosis of cervical cancer, even being as fortunate as I am and still being here, has a massive impact for the rest of your life.
You will be called for cervical screening appointments every 3 years between the ages of 25 and 49. After 50 and before 64, you'll be called every 5 years. The benefits of cervical screening are to detect problems early. Abnormalities within the cervix, if left unchecked and untreated, can progress to become a cervical cancer.
If people wish to book a cervical screening appointment, you can do this at your GP surgery, family planning clinic, a sexual health clinic, or WISC, which is all available online and it's in the city. Sometimes patients may ask for a longer cervical screening appointment, which is absolutely fine. We will always do our best to make sure that the patient feels comfortable at their appointments.
So generally in primary care, the person who does your smear is a practice nurse, and these practice nurses are very well experienced in doing smears, and you're very welcome to ask them any questions at all. If you have a really good relationship with a GP and you would prefer them to do the smear, you can ask for that to happen. And if you prefer a female, you can ring and check beforehand or call in and check that the person doing your smear will be female. So some people do ask if they can have a smear when they're on the period. Yes, they can, but it's not something we would recommend. The reason for that is because the blood in the sample can make it a lot more difficult to interpret, and you may actually need to have your smear repeated. So really, you're much better to have your smear when you're not actively bleeding.
So some people ask if they should have a test if they've never had sex. I would say that anyone who's any woman who's having any sexual relationship with it, man or woman, should still undergo a cervical screening test, even if it just involves sexual touch rather than actual intercourse itself. And also people will ask, should I have a smear if I've not been sexually active? We would say that would be your choice, but we would recommend that.
Some people also ask, can they ask questions before they have the smear? Absolutely, 100% they can. They can come to a pre-appointment if they want to have a discussion before they actually book in for the smear, so they feel comfortable and all of their questions are answered. So a cervical screening test should not hurt. It can make you feel a bit uncomfortable because it's an examination at the end of the day.
So when you have had your smears, what have you done?
I've asked for my asthma nurse to do it because I'm comfortable with her.
Yeah.
And she always does my smear test.
And if I go for a smear and if I'm wearing trousers, what would I need to do?
You have to take your trousers off and your underwear, and they will give you a towel to put over you. So
yeah.
Over you, so they don't see you.
Does it actually hurt you?
No, it doesn't hurt. It's just a bit uncomfortable at first.
So sometimes people will ask, do I need a cervical smear if they've had bleeding after intercourse or sex, if they've got pelvic pain or new vaginal discharge? No, I would say these people definitely need to book an appointment with a GP, because cervical screening is for people who have no symptoms and it's for screening.
So sometimes we may get asked if a patient can bring somebody along to their appointments, which is absolutely fine. We'd rather the patient be as comfortable as possible. But sometimes people may not have anybody to go to an appointment with them. So one of the staff members at the surgery or wherever you go for your smear will be able to come along, and it's called a chaperone.
So during your cervical screening appointment, you'll be asked to come in. You can have a conversation with the nurse and she will explain to you what the procedure is going to be. You will ask to undress from the bottom down, or if you have a skirt or a dress on, you can leave them on and just take your undergarments off. We will show you the equipment that we use, that is a speculum and a brush and the pot that it goes away in, and then we will ask you to get yourself comfortable on the bed.
About 2 years ago, I got a text message just inviting me for my regular smear test. At the time, I didn't really do anything about that. I didn't follow it up. I wasn't worried about my smear in any particular sense. About 6 weeks later, I got another text reminding me that I hadn't responded to the first text. So I thought I really should go and have my smear test done. So I went to the GP surgery and had my smear done. Didn't think anything of it. There was nothing unusual about it. But a few days later, I got a call from the local hospital asking me to attend their gynae department for some further testing. They'd found some abnormalities on my smear, my initial smear. 2 weeks after that, I had a phone call to say that I had cervical cancer, which was quite a shock. To cut a long story short, I've had extensive surgery. I've got some side effects that are going to be with me kind of forever, but I'm very, very grateful that I went for that smear, because it's definitely saved my life, and I think I'm doing really well at the minute.
The earlier that we can detect if you have cervical cancer, we can then offer you treatment. The earlier that we give you treatment, the better it is for you. Screening is the best tool that we have to keep all women ages between 25 to 64 well.
So for somebody who's waiting for smear test results, the time frame can vary, but it should be about 2 to 3 weeks until you get your results. And we always say, if you haven't heard anything by that time, to ring your GP surgery so they can chase that up and get you the results then. If anybody forgets or can't make their appointment, you don't need to worry, because you can just ring up your GP surgery or the facility that you had your smear at, and they'll just be able to book you straight back in for a new appointment.
Ladies, women, girls, get your cervical screening or smear test. It's easy to have done. You've just got to call your GP. It takes a matter of seconds to be done, and it's virtually pain-free. Nothing major about it at all. If anything's wrong, they'll detect it. It could save your life. Simple as that. Every 3 years, you need to have it done. It's something that you won't get signs and symptoms of necessarily, and it can be detected by a simple test. Cervical smear test, get it done.